Picture this: a child's devastating seizures that once left doctors completely baffled can now be traced back to a single faulty gene, and more remarkably, treated with precision medicine tailored specifically to that genetic flaw. This isn't science fiction. It's the revolutionary reality reshaping pediatric epilepsy treatment today. Dr. Sucheta Joshi, who serves as the medical director overseeing the Comprehensive Epilepsy Center within Children's Hospital Los Angeles Neurological Institute, has witnessed this dramatic transformation firsthand. As a leading expert in the field, she describes experiencing what feels like multiple medical eras compressed into a single career span. The evolution has been absolutely extraordinary, Dr. Joshi reflects. We've progressed from a place where we could only guess why seizures were happening in young patients, to pinpointing exact genetic culprits behind these disorders. And now we're actually developing treatments that target those specific genetic root causes. But here's where it gets particularly fascinating and controversial. The center she leads holds the distinction of being the sole Level 4 pediatric epilepsy facility housed within an independent children's hospital throughout the entire Los Angeles region. This specialized designation means they offer comprehensive diagnostic capabilities and cutting-edge treatments that enable personalized approaches for every single patient who walks through their doors. What's truly game-changing, Dr. Joshi explains, is that for certain epilepsy variants, we can now look parents in the eye and confidently tell them that targeted medications are on the horizon. Drugs designed not just to suppress their child's seizures temporarily, but to address the underlying genetic malfunction causing them. The revolutionary science behind personalized epilepsy care. Here's a staggering fact that might surprise you. Medical researchers have successfully identified more than 1,000 distinct genes connected to epilepsy disorders, and this number keeps climbing every year. This genetic goldmine has unlocked previously unimaginable precision treatment opportunities, which explains why Children's Hospital Los Angeles maintains a dedicated on-site genetic testing laboratory. Think of genes as instruction manuals for your body's cells. When these instructions contain errors, they can cause brain cells to malfunction in very specific ways. Dr. Joshi explains how this genetic understanding completely transforms treatment selection. Once we understand exactly how a particular gene influences brain cell behavior, we can strategically choose anti-seizure medications that we know will be effective for that specific genetic variation. Even more importantly, we can avoid medications that might actually worsen seizures in patients carrying certain mutations. And this is the part most people miss. The field is rapidly advancing beyond just medication selection. Clinical researchers are now actively investigating gene therapy approaches that could potentially repair or compensate for genes that aren't functioning correctly. Consider Dravet syndrome as a perfect example of this precision approach in action. This condition stems from mutations affecting the SCN1A gene, which controls sodium channels in brain tissue. Here's something that might shock parents, Dr. Joshi reveals. Certain commonly prescribed anti-seizure medications can actually trigger more frequent or severe seizures in children who carry this specific mutation because of how these drugs interact with sodium channels in the brain. However, the flip side is equally remarkable. We now have FDA-approved medications designed specifically for SCN1A-related disorders. When genetic testing reveals this mutation in our patients, we can immediately avoid the problematic drugs and fast-track them to these targeted treatments. Beyond medication, revolutionary non-drug approaches. But here's where medical treatment gets really creative. Genetic discoveries have also paved the way for highly effective therapies that don't involve traditional medications at all. The medical ketogenic diet represents one of these breakthrough approaches, a carefully calculated, high-fat, moderate protein, natural compounds, and diet, extremely low-carbohydrate eating plan that can work remarkably well for specific genetic epilepsy types. Let's break down how this works with GLUT1 deficiency syndrome, a condition that perfectly illustrates the elegance of precision medicine. Patients with this genetic disorder struggle to transport glucose, the brain's preferred fuel source, from their bloodstream into brain tissue. This essentially starves the brain of energy, triggering various neurological symptoms, including seizures. The ketogenic diet offers an ingenious workaround. When the body breaks down dietary fats, it produces molecules called ketones, which serve as an alternative fuel that the brain can readily use. The seizure reduction we see with this approach can be absolutely dramatic, Dr. Joshi emphasizes. She also points out that surgical interventions and neuromodulation techniques, sophisticated brain stimulation methods, have achieved remarkable advances in either significantly reducing seizure frequency or eliminating them entirely. The uncomfortable truth about treatment gaps. Now, here's the controversial reality that the medical community doesn't always discuss openly. Despite all these advances, approximately 25 to 30% of epilepsy patients continue to experience treatment-resistant seizures. In other cases, available treatments might reduce seizure frequency but cannot completely eliminate them. The timing factor is absolutely crucial, Dr. Joshi stresses. Getting children to comprehensive pediatric epilepsy centers for genetic testing as quickly as possible is essential for effective treatment outcomes. The uncomfortable truth is that we still lack consistent access to genetic testing nationwide, and without addressing this disparity, we cannot ensure that every child receives these state-of-the-art diagnostic and therapeutic interventions. At Children's Hospital Los Angeles, the collaborative approach sets them apart. We're incredibly fortunate to have seamless cooperation between our medical genetics specialists, neurologists, epilepsy experts, and our Center for Personalized Medicine, Dr. Joshi explains. This integrated team approach allows us to develop truly individualized treatment plans for every child we encounter. But here's a thought-provoking question that challenges our current healthcare system. If genetic testing can so dramatically improve outcomes for children with epilepsy, shouldn't this technology be universally accessible rather than concentrated in specialized centers? And here's an even more controversial angle. Are we creating a two-tiered system where children's access to cutting-edge treatments depends more on geography and healthcare resources than medical need? What's your take on this genetic revolution in pediatric medicine? Do you think the benefits justify the costs? Or are we moving too fast without considering the broader implications for healthcare equity? Should genetic testing be standard for all children with epilepsy, regardless of their location or insurance coverage? Share your thoughts. This conversation affects real families dealing with these challenges every day.